In regards to treatment plans and intervention, there are two main things that can treat ADHD. One being medications, and two being therapy, specifically cognitive behavioral therapy. So in regards to medication options for ADHD, there are two main choices. This is the first choice. It's a methylphenidate medication. These are stimulant-based. They are an immediate release formula, and they increase the amount of dopamine in your brain. The most common form of a methylphenidate medication is Ritalin. The other medication option is a dextroamphetamine-based medication. This is a slower release compared to methylphenidate. Dextroamphetamine enhances the amount of dopamine and norepinephrine in your brain. The most common, or the most generic named drug of this is Adderall. Most commonly, people take Adderall XR, which is a 10 to 12 hour. Another option for ADHD treatment or coupled with medication is cognitive behavior therapy. CBT is a short-term, goal-oriented form of psychotherapy that aims to change negative patterns and negative ways of thinking into more positive mindsets. People with ADHD often suffer with super negative self-talk and negative thoughts about themselves due to their inability to complete tasks successfully or complete them in an appropriate time manner. So people will enroll in cognitive therapy, behavior therapy to help with those symptoms. A lot of the extra support that you're going to give to a student with ADHD is also support that you should be just using generally in your classroom. So lots of structure, help organizing their thoughts with graphic organizers, things like that. Lots of encouragement, having fidgets and flexible seating available, and then using positive reinforcement to help students comply with expectations. All of these are going to make your students with ADHD feel more included, and also your students in your just general education feel much more included. In regards to collaborating partners in ADHD, people with ADHD typically are diagnosed with other mental illnesses such as anxiety or depression due to the negative nature of their self-talk. And some of your collaborating partners might be a behavioral therapist, so the child's cognitive behavioral therapist, a psychiatrist, and their parent figures. You should be working closely with all of these people if you are developing an individualized education plan.